Hi everyone, and welcome back to Wellness Overload. Today, we're diving into a crucial topic, postpartum depression. This condition affects many new mothers and can have a significant impact on both their mental health and their ability to care for their newborns. Let's explore what postpartum depression is, its symptoms, and some strategies for coping and seeking support. It's important to shine a light on this issue and provide guidance for those who may be struggling. What is postpartum depression? Postpartum depression happens when a person feels very sad or down after having a baby. It can start during pregnancy or within a year after the baby is born. Depression is when someone feels really bad and it affects how they think, feel, and act. It can be hard to tell if someone has postpartum depression because being a new parent is already tiring and stressful. Feeling tired, sad, or hopeless after having a baby is common. But if these feelings make it hard to do normal things like taking care of yourself or your baby, it might be postpartum depression. Causes of postpartum depression. Many factors can make new moms more likely to have postpartum depression. Women who've had mental health problems before, like feeling very sad a lot, are at a higher risk. Other things that can raise the chances of postpartum depression include not eating well, not getting enough sleep, drinking too much alcohol or using drugs, and having low levels of certain hormones can also make postpartum depression more likely. Hormones, which are chemicals in the body, change a lot during pregnancy and after having the baby. Before birth, levels of certain hormones go up, and after birth, they go back down. This sudden change can sometimes make a new mom feel depressed. Feeling emotionally tired can happen because of stress during pregnancy, being sick, not having enough money, feeling lonely, or if the baby has health issues. If someone in your family has had mental health problems before, you might be more likely to have postpartum depression too. Even if you're healthy and had a regular delivery, you can still have postpartum depression. If you've had depression or anxiety before, you're more likely to have it again after having a baby. It's important to tell your doctor if you've ever felt really anxious or sad before. Sign and symptoms of depression after pregnancy. Depression after having a baby can make it hard to do normal things. The signs can be different for everyone, but here are some things to look out for. Not being able to sleep even when you're tired. Having a hard time focusing on things you need to do. Having pains or feeling sick without a clear cause. Feeling really mad or upset for no clear reason. Feeling like you're not worth much and can't control things. Feeling very worried and having sudden moments of intense fear. Feeling guilty and sorry for yourself. Avoiding being around people, even your friends and family. Swinging between very different moods. Worrying a lot about your baby, or not feeling interested in taking care of them. Not wanting to do things you used to enjoy. Not feeling hungry or eating too much, which can make your weight change suddenly. Crying a lot for no clear reason. If you keep having these signs for a while, it's important to talk to a doctor. These signs can show up shortly after having a baby, and, if not treated, can stick around and harm the mom's mental health for a long time. Postpartum psychosis. Postpartum psychosis is a very rare mental health condition that often starts in the first week after giving birth. It's different from postpartum depression, and its signs are more serious. Some signs include having trouble sleeping and having strange sleep patterns, feeling very suspicious or scared for no reason, feeling very confused and not knowing what's going on, being overly fixated on the baby, believing things that aren't real and seeing or hearing things that aren't there. Postpartum psychosis is a very serious condition that can make someone think about harming themselves or their baby. It needs medical help right away. Difference between depression and postpartum depression. Depression and postpartum depression are similar, but there's a key difference. Postpartum depression happens after having a baby and is connected to things like hormones changing, the environment shifting, and emotions shifting. Women who've had depression before are more likely to have postpartum depression. Difference between postpartum depression and baby blues. Here are the main differences between baby blues and postpartum depression. The symptoms of postpartum depression are much more serious than those of baby blues. Baby blues usually make you feel sad and vulnerable, while postpartum depression can make you feel anxious, irritable, sad, uninterested in your baby, and like you're not doing a good job as a parent. Baby blues show up right after the baby is born and usually go away within a week or two, while postpartum depression can start during pregnancy and last a lot longer, affecting both the mom's physical and mental health. Baby blues often get better with rest, calming down from the anxiety of giving birth, and support from family, while postpartum depression usually needs ongoing counseling from a professional to help you feel better. Baby blues only last for a short time, usually about 2 weeks after giving birth, while postpartum depression can last up to a year after giving birth. Complications of postpartum depression. Depression is a long-lasting problem that comes and goes in cycles. It has a big impact on someone's mental health and can cause lasting problems that affect them for a long time. It can also affect both parents and their children. To mothers, if postpartum depression isn't treated, it can last for months or even longer and become a long-term depression problem. This can cause serious complications for mothers, such as mental health impact. Postpartum depression can severely affect a mother's mental health, leading to negative changes in her lifestyle and making her withdraw from her surroundings. If left untreated, it can increase the risk of future episodes of major depression, leading to long-term unrest and difficulty in recovery. Physical health effects. Depression can also have adverse effects on a mother's physical health, increasing the risk of obesity, heart problems, and chronic illnesses. This is often due to changes in lifestyle caused by the mental trauma of depression. Risk of suicide. Depression can make someone more likely to consider suicide. Up to 2/3 of all suicides are linked to depression, which can stem from changes in lifestyle, withdrawal from society, increased irritability, and disruptions in daily routines. To fathers, postpartum depression doesn't just affect the mom and baby, it can affect everyone around them too. Dads are especially at risk because being close to someone with depression can make them feel sad too. Even if the mom isn't affected, new dads can still feel depressed. To children, kids whose moms have untreated postpartum depression might face emotional and behavioral issues because their moms may not give them enough attention. They might end up having ADHD and other problems like crying a lot, trouble sleeping and eating, and taking longer to learn how to talk. Diagnosis and test for postpartum depression. To diagnose postpartum depression, doctors look at specific symptoms and criteria. If someone has symptoms of depression or a family history of it, they should talk to their doctor and consider getting screened for depression. The doctor will try to figure out if the baby blues will go away on their own or if they might turn into serious depression. They might do blood tests to check for hormone changes or thyroid problems that could be causing depression symptoms. Health professionals might also use tests like the Beck Depression Inventory or the Hamilton Rating Scale to see if someone has depression. How long does postpartum depression last? Postpartum depression doesn't have a set duration. It varies based on when it's detected and how it's treated. It can start during pregnancy or a few weeks after giving birth. If a woman gets treatment early, the depression symptoms might last for about a year or even longer. But without treatment, it could last for more than 3 years. Postpartum depression treatment. The treatment for postpartum depression depends on how serious it is. There are different ways to handle it, like talking to a therapist, getting counseling, or taking medicine. Number 1. Psychotherapy. Therapy, like talking to a psychiatrist or psychologist, is one of the best ways to treat postpartum depression. In therapy, you talk about what's bothering you, and the therapist helps you find ways to deal with it and feel better. They can help you solve problems, manage your moods, set achievable goals, and react to things in a more positive way. Number 2. Counseling. Counseling is another way to treat depression, where you talk directly to a counselor or psychiatrist. It can help if you're feeling down, especially if the depression is not too severe. There are different types of talk therapies, but the ones often used for depression are cognitive behavioral therapy and interpersonal therapy. Cognitive behavioral therapy, CBT, is all about changing how you think and act, and it's really good at helping with anxiety, obsessive-compulsive disorder, depression, and other mental health issues. CBT works on the idea that your thoughts, feelings, actions, and physical sensations are all connected, and negative thoughts can make you feel stuck in a cycle of depression. It helps break down problems into smaller pieces and turns negative thoughts into positive ones. CBT gives you practical ways to improve your thinking every day. Interpersonal therapy is when a therapist works directly with someone who's depressed. They focus on 4 main problems: dealing with loss, changes in roles, arguments with others, and struggles with relationships. It's been shown to be really helpful for treating postpartum depression. Number 3, antidepressants. Antidepressants are drugs used to treat major depressive disorders, including postpartum depression. Antidepressants balance out the brain chemicals, which are responsible for regulating moods and making you feel better. However, antidepressants have side effects and may also enter your breast milk. Hence, antidepressants should be consumed only on a doctor's prescription. Number 4, medication. For severe depression, doctors might prescribe a combination of medications like antidepressants, mood stabilizers, and antipsychotic drugs to help manage the symptoms. But it's crucial to only take these medicines if your doctor prescribes them. Number 5, electroconvulsive therapy, ECT. Electroconvulsive therapy, ECT, is sometimes used when postpartum depression is really serious and doesn't get better with medication. During ECT, a small amount of electrical current is passed through the brain to create waves like those in a seizure. This can lead to chemical changes in the brain that help lessen depression symptoms. Home remedies and lifestyle. While postpartum depression typically requires professional treatment, making lifestyle changes at home can support the recovery process. Embrace healthy habits. Incorporate physical activities like walks with your baby to manage stress. Prioritize rest, eat nutritious foods, and avoid alcohol and smoking. Stay connected. Share your feelings with loved ones to gain perspective and avoid isolation. Self-care. Treat yourself to relaxing baths, wear your favorite clothes, or spend time with friends or your partner. Engage in hobbies or enjoy favorite foods to rejuvenate yourself. Set realistic goals. Avoid overwhelming yourself with excessive responsibilities. Set achievable expectations and don't hesitate to seek help with household tasks or baby care. Seek support. Don't be afraid to ask for assistance from your partner or family members when needed. Communication is key in managing postpartum challenges. How to prevent postnatal depression. Taking precautions and adopting a controlled lifestyle can help prevent postnatal depression. If you have a history of depression, especially after giving birth, let your doctor know as soon as you become pregnant or plan to. Here are some tips to prevent postnatal depression. During pregnancy, avoid stress as much as possible and stick to a healthy diet and simple exercise routine. If you feel depressed, talk to your doctor. Mild depression can often be managed with support groups or therapy. In some cases, your doctor may recommend antidepressants during pregnancy after birth. If there's a history of depression in your family, your doctor may suggest a postpartum checkup to catch any signs of postpartum depression early on. After having your baby, don't overwhelm yourself with too much work. Take small steps to ease back into your routine. Early detection of depression symptoms can help prevent it from getting worse. What can happen if postpartum depression remains untreated? Untreated postpartum depression can escalate into chronic depression, causing strain on the mother-child bond and impacting the entire family. Severe depression may even lead to chronic illnesses, or, in the worst cases, suicide. Additionally, postpartum depression can adversely affect the child's upbringing and overall development. It's crucial to seek help and support early to prevent these negative consequences. Postpartum depression is a serious condition that shouldn't be ignored. Detecting it early and getting treatment right away can stop it from becoming chronic depression. Don't try to deal with it alone. Talk to your family, friends, and doctor to get the support you need to handle postpartum depression. If you found the video helpful, please consider giving it a like and sharing it with your friends and family. It could brighten their day and contribute to their happiness. And don't forget to subscribe if you haven't already. See you in the next video.